It has been 6.5 weeks since my SI fusion surgery, so I wanted to tell you guys what happened during my hospital visit, and then I'll make another video later about my progress so far. So, I get to the hospital, I'm, getting all the pre-op stuff done, talking to everybody, telling them, I have all these allergies, I have all these issues, we've made a plan, don't give me any of the pain medications. We've talked about a nerve blocker and some extra numbing medication to help with post-op. Don't give me any anti-nausea medications, so on and so forth. And they're like, really? I'm like, yes, 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 yes. So they're like respecting me, but still kind of quietly gaslighting me, like they don't believe me. They're listening, but they're not really hearing me. I had one nurse who was asking me a lot of questions about my EDS, and I'm like, she's trying to gaslight me. Turns out, no, she's pretty sure she has it, and she wanted to know what she should be looking for, what doctor she should go to, how should she get diagnosed, and we ended up in this really big conversation. It was really cute because she said she was supposed to be the nurse for the patient next door to me, but something changed and she ended up being my nurse, and she really feels like she was meant to be my nurse that day. It was meant to happen because I was able to talk to her about these things, and it was a really special moment. But anyways, so she believed me, but everybody else was just kind of like apprehensive on whether to believe that I have this huge list of allergies that barely fit on the bracelet they have you wear. And then they gave me Versed before wheeling me to the OR, and I was out. I don't even remember being wheeled down the hallway. And while I was under, I had an allergic reaction to the marker that the surgeon used to mark up the area, and they ended up having to give me Benadryl while I was under. And then they believed me. You can't not believe me at that point. Like, I'm not a hypochondriac. I'm not making it up. You can see I'm allergic to friggin' everything. So now they believe me, and they bring out a list of everything they used and how much they used, and gave it to my husband and told him what happened. And they don't usually do that. They don't usually tell you about what happened during surgery. If you have an allergic reaction, or you go into VTech or something like that, they just fix it and then you go to recovery, and they don't usually inform you or the family of what happened unless it was like a crisis. But we fixed it, you don't need to know about it. But they told him, they brought him the list because they were like, we believe her now. And I woke up in the recovery room shaking bad, not like trembling, full on shaking, terrified, can barely talk. I'm looking at the nurse, and he's like, hi, welcome back, whatever. He's like, I'm gonna give you some fentanyl for the pain, and I'm gonna give you some medication I've never heard of. And I'm like, no. I can barely talk. And he was like, yeah, ma'am, calm down, this is what we do. And I'm like, no, allergic. And he's like, you're allergic to it? And I'm like, don't know. He's like, it's fine. If you have an allergic reaction, you're here. It's not on your list, so it should be fine. And I'm like, no. He says, it'll help with the shaking. I said, scared. He said, don't be scared. You're here, and you're going to be fine. And then he gave it to me. No means no, people. Okay? Thank goodness I didn't have an allergic reaction to it, but that pisses me off. Then I woke up in my room where family can come to visit. My husband was there. I woke up in extreme pain, okay? I got this done without pain meds, and like, he gave me fentanyl, but he gave me an extremely low dose because I'm so hypersensitive to things. And I've had max dose of fentanyl before and it doesn't do anything for me. Like, and I know that sounds like exaggerating, but it's not. You're just going to have to take my word for it. I've been maxed out on fentanyl, Versed, Benadryl, Valium, and they, like, nothing. And they go, you've had enough to sedate a horse. Like, what is happening? And I'm fine. Nothing's changed. My body either has a horrible reaction to medications or they don't work. And it's really rare that a medication actually does what it's supposed to do for me. So I woke up in massive pain and I'm shaking, I'm screaming, and I'm passing out over and over and over again. And they're arguing about what they can do for me because I can't take any of the pain meds. And I had already told them that I didn't want to try something new because if I have a terrible allergic reaction on top of the pain that I'm already going through, then I'm just adding to my suffering. So they spent well over an hour arguing about what they could do for me. And in the meantime, I'm just suffering, screaming, in shock, passing out a lot. And they ended up giving me some Valium to help with the shaking. And that was all they could really give me. Once the shaking stopped, they offered me Toradol, which is basically just glorified ibuprofen. It's an NSAID. It doesn't really do much. It mostly just helps with inflammation. It doesn't take away the pain. But they gave me that. And I was able to get through the remainder of the day. It was really, really terrible. It was really terrible. Usually you leave within a couple hours of waking up from surgery. I ended up staying for 3 days. And while I was there, they kept me on Valium and Toradol. But I was still having tremendous pain. And at some point when you're there, like, there's nothing they're doing for me there that I can't do at home. And I don't want to be there anymore. So I just want to go home. Even though I know I'm safer in the hospital, I don't want to be there. And they come in every hour to check on you so you don't sleep, and all you need is fucking rest. And like your body needs to heal when you do your best healing when you're sleeping, and like you can't sleep and you're stressed, and it's terrible. So I had to prove that I could get up and onto a bedside commode and use the restroom before I could leave. So I did that on the last day, and they released me to go home. The drive was not fun. Recovery since then has not been fun. I would not suggest getting surgery without pain meds, especially when they're drilling holes into your bones. They sent me home with some Valium and 2 days worth of Toradol, but I didn't take any more Toradol. And I took half a Valium on that first day home to help me sleep, and I haven't taken anything since then. I've been doing this whole recovery without anything. No ibuprofen, no Aleve, no Toradol, no Valium, no nothing. Ice and heat kind of numbs the first few layers, which is a little bit helpful for the first, I'd say, 2 weeks. But it's not enough. It still hurts like hell. And like I said, I would not suggest it. But I'm going to work on finding something, because I don't plan on getting surgery again due to what happened to me. I don't want to ever go through that again. But, you can't stop bad things from happening. What if I slip and fall and break my hip? Do I just not get it surgically fixed? I mean, I can't not get surgery ever again, so I have to figure out something. So we're going to experiment with some different things. They want me to try ketamine, and we're going to try, even though I was allergic to morphine, we're going to try it in the pill form and see if it just had something to do with the IV, because I don't tolerate IV meds well at all. It causes me a lot of pain. They have to dilute it quite a bit so that it doesn't hurt so much, which is super weird. But also I'm hypervascular. If you have EDS, drop it in the comments. Let me know, are you hypervascular without having vascular EDS? Because I don't have type V. I don't have the vascular EDS. I have hypermobile EDS. I was blood tested for the VEDS, but I'm hypervascular everywhere. My thyroid was hypervascular when they did imaging of that. My abdomen, when I've gotten 2 laparoscopies there for my hysterectomy and appendectomy, was hypervascular in there. Every time I get imaging, they are like, you're hypervascular. And I have no idea what causes that. But anyways, I think that might have something to do with why I don't tolerate IV drugs very well. And also it's weird, like, I don't think you can see it, but there's still marks right there from where the IV was 6.5 weeks ago. What in the world? Still have bruises all over. But I'm gonna show you some images of my incision from the day that I left the hospital till now. And like I said, I'll make another video about what recovery has been like since the procedure, but this is just about the procedure. And please keep in mind, don't let me talk you out getting this procedure done just because of my experience. I'm different from most people. Most people get pain meds and you won't have to worry about any of this stuff. Most people don't have allergic reactions to everything, so you don't have to worry about it. I don't want you to be scared to get this procedure if you really need it. I'm just telling you what happened to me. My experience sucks. I would never do it again. And I'm not entirely convinced that it was worth it at this point. But I guess we'll see after the 3 months. They say that's what I need to give it, so I'm halfway there. I'll keep you guys updated.